Welcome to Lit Politics. I'm State Senator Alessandra Yuh-Line, representing the 34th District, covering parts of the Bronx and Westchester counties.
And I'm Assemblymember Yuh-Line, representing the 65th District in Manhattan, covering all of Lower Manhattan. Today, we are going to be having a dialogue from both of our houses, the Senate and the Assembly.
That's right, to shine a light and to have an important dialogue
about the process that we know as government.
And most importantly, how it affects you. Hello everyone, and welcome back to Lit Politics. As you know, we are doing a little series of short explainers on how to break down the very intense things that you're seeing on the news about the scandal that is taking over New York and your Twitter feed.
So we're diving deeper into the scandal that's currently engulfing Albany and the Cuomo administration. It's tempting to describe this, as a lot of media outlets have, as a nursing home scandal, but what we're facing is much more than that. It's an emergency powers scandal, it's a cover-up scandal, and all roads seem to lead back
Where?
to the governor's mansion.
Interesting. Today we're going to focus on all of the immunity language that you are probably hearing so much about and why it is such a critical issue for the legislature to address.
So in a column by David Sirota, written on just Tuesday, he called our ongoing crisis the biggest political scandal in America right now. And it's hard to disagree with his view. It's becoming painfully clear that the governor not only undermined public trust by withholding critical data about COVID-related nursing home deaths, he also worked to protect nursing homes from the legal consequences of those deaths. For a governor known to be brash and loud, it's how quietly and secretly the governor's office actually did all this that kind of sent shockwaves through Albany.
How ironic.
Yeah, let's dive into how we got there.
Okay, great. So let's talk about the background, right? So the immunity language first makes its appearance on the New York stage on March 23rd of 2020. The first immunity language that was signed was an executive order. It was Executive Order 202.10, which many have referred to as a version of the Good Samaritan Law EO, executive order. This immunity covered volunteers for hospitals and also other medical professionals. And why is this immunity provision important, and why is it important in this executive order? Because at that very time, all of us can remember, unfortunately, we had a shortage of healthcare workers and a surge of COVID patients.
Yeah, I remember that the governor actually made a call, to the entire public, asking for healthcare workers across the world to come and volunteer in New York City.
That's right. In fact, it was across the world almost,
yeah,
right?
Across the
world. So this executive order provides immunity to civil and criminal liability for frontline medical professionals. In particular, the executive order provides protections for individuals providing medical services, either in a professional or a volunteer capacity during the 2020 pandemic.
I think that's the important part, the volunteer capacity.
That's right.
Yeah, we really needed a lot of volunteers at that time.
That's right.
The second time the immunity language actually appeared in our state is actually in our New York State budget last year, a budget I did not vote
Tell
for.
us all about that.
Yep. The budget
did
passed
I.
this language that included sweeping new immunity protections for nursing homes, a provision that was buried in the massive spending bills. Not many people were actually even aware of its existence until after the bills were voted on.
My God.
And it was slipped in the dead of night. In that provision, legal immunity is guaranteed, and you're going to have to explain this for us a little bit, but is guaranteed for private sector nursing home executives, trustees, board members, and shareholders. What does that mean, Alessandra?
Meaning, it was a corporate immunity provision, right? So it was a provision also written by and stuck in language that came in from the executive, also known as our governor's office, in the dead of night, right before the budget vote. I remember it very, very, very top of mind, like it was yesterday. It was almost with 30 minutes to spare we saw this budget provision.
Literally, there was these are extra things, and we didn't even get to really talk about it.
That's right.
It was like nobody knew the real repercussions of it, you
At
know?
all.
And to talk about this provision, we are actually luckily joined by two legislators, one which sits right here, you, that actually introduced the legislation to repeal this corporate immunity provision. Could you introduce our other friend?
I would love to. Our other guest is Ron Kim, who is the assembly member from Queens, who I'm sure many of you have heard a lot about in the past few days. And he has been at the center of this because he has been speaking out about this issue since his uncle's death in a nursing home during this pandemic.
Hey, Ron.
Hi.
So I'm just going to ask a couple of questions. So what did we learn from the AG's report and about how these deaths were being hidden?
Well, the AG's report was very comprehensive, that there was more than 50% undercounting of the nursing home deaths that was reported by Governor Cuomo, and also validated that the legal immunity was the wrong policy in place. And lastly, it also said there's profit-driven motives that were extremely dangerous in the nursing home sector.
And what were those profit-driven motives?
Well, the industry is like around 65% for profits in New York State. So when you're talking about nursing home, any kind of healthcare facilities that are fundamentally driven by profits, they're not in it to invest as much money toward people, toward taking care or direct care of the patients or the residents. And top of that, like if you're giving them a disincentive like a legal immunity, they no longer feel like they're obligated to spend any money toward their residents.
So the governor refused to publicize the sweeping violations of infection protocols among the nursing homes. Do we know what kind of additional damage that silence might have caused?
Yeah, I mean, we started to dive into a little bit of it in our private meeting last week in terms of what were the violations look like. Did they revoke any licenses? We were going over some of their raw data, but it was clear that they did not really crack down on any of the bad operators. And I know for a fact that when some of the investigative reporters foiled those inspections, some of the worst nursing homes at the highest death rates they got a passing grade in April and May. So inspectors showed up, and we know that we had hundreds of people who died there, but they still got flying colors. So there was a big disconnect. But I know what happened because I saw in my nursing homes some of the top lobbyists that work directly with the governor's office. They knew when the inspectors are coming in. It was a coordinated effort. So they already got a heads up. They're waiting for them in the nursing home site. It was like it was. I saw it, and I recognized, like, there's a clear effort to kind of control the numbers. I mean, they were more concerned about what the message is and the PR spin is, even on the ground.
How was the governor's office processing those nearly 800 complaints about these nursing homes filed with the AG's office? Were they just hidden away?
The 800 complaints of nursing homes throughout this process. Yeah, no, they have a record of it. They, like I said, I think the highest fine was like $2,000. But again, there was no revoking of licensing. And I think hopefully I can get the actual report, and I have to review it. But that's one of the problems. But at the same time, and I discussed this with Senator Rivera, like we don't want to take a punitive approach either. So we don't want to empower, especially this governor, with more ability to punish them. So we're kind of stuck in this space. What do we actually have to do to get around this and hold them accountable? So we're having active discussions right now. One option that Dick Gottfried and I are working on is mandating a ratio of direct care investments. So when you have a for-profit and you get a Medicare reimbursement, right now they can keep like 50% of that toward like profits and administrative costs, but we're trying to raise that to standard to 70% have to be spent on direct care.
Do we see any evidence that Cuomo's immunity gift to the industry led to riskier behaviors in handling COVID by nursing home management?
Yeah, our early signs, when we looked at the national data, almost 77% of all the COVID deaths back in May, June came from states that had a version of the legal immunity, or roughly 20 states had a 77% of nation's deaths, and the states that had similar language like New York had the highest number of deaths. So there was definitely a trend and a correlation that we put out. But obviously, the moment that they have the numbers and stop counting the hospital deaths, that number went all the way down to like 50, 34th ranked in New York. So it no longer, our thesis no longer stood ground. And that's one of the reasons why we couldn't really legislate. We didn't have a sound argument. But if we had all the real data and the trends, Senator Biaggian had a much better argument to say we have to repeal this because there's a correlation here.
So the governor is no stranger to the healthcare industry and its web of political influence. As one of his biggest donors and political allies, Cuomo's network of political organizations actually raked in over $2 million from organizations like Greater New York Hospital Association, who you questioned. Thank you for doing that.
Sure did.
And its connected lobbying groups. This constant flow of money, which hit a record as coronavirus was decimating New York, reveals a very cozy relationship between the people responsible for improving public health and the government officials tasked with regulating them.
What does this mean? Essentially, it means that the healthcare industry had an open door to Cuomo, following over $1 million in donations in 2018, designed specifically to protect Cuomo from a progressive Democratic primary challenger, none other than Cynthia Nixon.
I remember that race.
Me too, just like yesterday. That money and the victory it ensured continued to buy access for healthcare industry executives as the COVID threat spiraled into an actual public health crisis. Just think about that. It allowed them to have access to one of the most important parts of our legislative process, the budget, which is one of the most important and consequential documents that we negotiate and legislate and work with and work through for all the people in New York.
What's crazy is it's not even the healthcare workers, right?
That's right. It's for the shareholders. It's for those who actually are worried about their profits.
Does that make your eye twitch?
Yes. It twitched for many months.
I mean, it's also clear that the immunity provision didn't originate with Cuomo's office or anyone tasked with defending the best health interests of New Yorkers.
No,
I mean,
not at
you
all.
actually caught on to this because in an April 2020 press release, GNYHA, which Greater New York Hospital Association, the multi-million-dollar Cuomo campaign mega donor that we mentioned just 5 seconds ago, patted itself on the back for writing the nursing home immunity language that Cuomo would insert nearly unchanged in his budget proposal to the legislature.
Oh, that's so interesting, because I remember actually asking about this during the hearings in the summer. So Greater New York Hospital Association said in this press release, quote, that they drafted and aggressively advocated for this legislation. That's what the release
Aggressively.
said. Aggressively, yes.
Drafted.
And advocated for.
And advocate.
Yes. They also said, quote, we are deeply grateful to Governor Cuomo and the legislature for hearing our concerns and working with us so effectively. Now I have to just pause for a second because the fact that they're grateful to the legislature for hearing their concerns and working with them so closely. I don't remember working with them. I don't remember hearing from them at all, actually, so it's just curious.
I think they meant that they put donations into some people's coffers.
Probably.
Just saying. The healthcare lobbyists behind nursing home immunity weren't actually trying to hide their fingerprints. Not only were they not trying, they bragged about it, right?
Correct.
But the Cuomo administration went out of its way to hide that language in the budget proposal.
They sure did, and now, faced with public outrage over this sweetheart deal the governor cut and the 15,000 dead nursing home patients whose families likely have no real legal recourse at all because of immunity, Cuomo is choosing to attack his fellow Democrats. Me? You? Assemblymember Kim? Yeah. I know. I don't really understand, actually, at all either. Makes no sense.
And what's actually in the bills, though, right? And why Democratic lawmakers are now calling out not only for a removal of the qualified immunity from nursing homes, but for stripping Cuomo of those emergency powers he's used to protect his corporate campaign donors in the middle of a public health crisis.
Which is just so Ludicrous. So let's talk about the bills, okay? So
Yes.
what did we do after the budget passed? So May 10th and May 19th, respectively, Assemblymember Ron Kim and myself
Thank you for
submit
doing
the
that.
bills, thank you, to repeal the nursing home corporate immunity provisions. There's a lot of discussions. There is a lot more pushback, and that pushback came from the executive and special interests about this corporate immunity provision being retroactive.
Okay, all right. Because you're a lawyer, you say those words so easily. But what is retroactivity?
So retroactivity means that a law can take away or impair a previously vested right. It can impose new duties or obligations or changes or affect past transactions or legal actions. So essentially, you can say this law was in effect, but we're actually going to take away the effect of that law, not only moving backwards, but also moving forwards.
Got it. So, I mean, just from like my layman's standpoint, not as a lawyer, like I started to notice a lot of these contradictions happening, right? Like, why is it that the immunity provisions that they were giving could be retroactive, and why not then the bill to stop the
Such an interesting point, actually. Such an
immunity?
interesting point.
Why is it that one thing is okay to be retroactive and yet not the thing to stop that thing?
So that's a good point. Okay, so let's break this down as easily as we possibly can, right? So we passed the budget, the corporate immunity provisions are in there, okay? When we passed the budget and the budget was signed into law on April 3rd, 2020, the corporate immunity went into effect. And so that meant that moving forward, April 3rd forward, we basically said there's immunity for corporate health care facilities.
Yeah.
Okay. But what it also meant was that it took away the rights of those New Yorkers from March 7th to April 3rd, because it retroactively applied. So it took away the rights of New Yorkers from March 7th to April 3rd, and those individuals who may have been harmed or may have experienced harm or whose loved ones may have experienced harm.
You didn't say that it was COVID-19 positive. That means anybody.
Anybody. It means if you went to the dermatologist, did you go to the podiatrist? Did you have to?
I have a knee problem.
Well, then if God forbid something happened during that entire session that you went to where you had to deal with your leg, I'm sorry, you have no legal recourse at all.
New Yorkers, did you know this?
This, to me, was part of the most egregious piece of this language. And I think that most individuals who read the language or who got the language did not understand that it actually retroactively took away the rights of New Yorkers to have legal recourse. So think about it in terms of maternal mortality, which we know is incredibly high in the state of New York, especially for women of color. We've just lowered the standard of care beyond the place where it already was, which was already very low. So there were 2 instances I can think of where 2 women of color actually died during childbirth. Those families have no legal recourse in Brooklyn and the Bronx.
Wow. So how can people get any help? Like, can they get together and still do a class action? No.
No.
Wow.
That's why we have to repeal the immunity provisions.
But there's no retroactivity for any of those people.
Well, not yet.
Wow. So what then did you do?
So we tried to repeal the immunity provisions in July. There was another bill that was introduced. It clawed back some of what we did during the budget, and so that was July 23rd, 2020, 4 months after this immunity provision had gone into effect. And essentially what this did was 3 things, okay? Number 1, it amended the definition of healthcare services that are eligible for immunity and liability by removing the word, quote, prevention of COVID-19 from the definition of healthcare services. Okay. Number 2, it clarified that the immunity applies to the assessment or care of an individual with a confinement or suspected case of COVID-19. And number 3, it removed immunity protections for healthcare facilities or healthcare professionals that is arranging for healthcare services. So yes, it took back some of the immunity given, but it did not fully take back or fully release the immunity that was granted for corporate shareholders.
So I heard that, you actually, I mean, I know that you guys thought about this bill, but I'm going to ask Ron a little bit about, what they actually passed too, because I know that when you were hoping for retroactivity. So that was one of the pieces that was big. The fact that you did pass a piece of legislation to do some things to take away the immunity that was given to nursing homes, but what was in the bill and what wasn't in the bill is really important here, right? And so what happened behind the scenes to make it so that these things were left out of the bill and things were put into the bill?
The the original legal immunity was very broad. It gave retroactively immunity for non-COVID patients and COVID patients in hospitals and nursing homes, and to the business executives and trustees, board members, etc., for criminal and liability acts. And the revision or the amended version that we ultimately passed only focused on nursing homes prospectively and took out certain wordings like arranging care for. So you no longer have a legal immunity for arranging care or transferring patients. There are a few components of treatments that we had a blanket immunity. We struck that away. So meaning, if you are a nursing home resident and you're being arranged care and you catch COVID, you have standard liability now. You can sue if you catch COVID in a nursing home and there was standard liability or damage done to you of negligence based on just regular negligence. Now you have a recourse to sue.
And I think that we were talking also about how, it seemed like the immunity language that was put in had retroactivity in it for the corporate folks that they were protecting, and yet the immunity language that you were trying to put in should have been mirroring that language, and yet they didn't, and they were saying that that was unconstitutional, and yet there was this contradiction. What do you think of that, and what was going on there?
Yeah, and that was Senator Biaggi's main point. Like, and she brought it up. Like, they did it retroactively, so why can't we do it retroactively? And she stood that line, and she was like, "I'm not budging on that. Like, it's ridiculous." I'm sorry. Oh, thank you, Olive. She said it's lunchtime, but it's dinner time. Um, Yeah, so that's really, and it was actually you too, you mean that you really made that point very clear. And also on top of that, again, if we saw all the data points in real time, we would have presented that argument that giving legal immunity at the peak of pandemic to these horrible nursing homes that are profit driven leads to death, and we would have made the case to repeal it retroactively, I believe.
And Senator Biaggi, actually, you made the point of it being a corporate immunity.
It was corporate immunity. It was very much a corporate immunity provision. One thing I really think is important to just get clear about, right? Because we talked about emergency powers. We talked about immunity provisions. We're talking about the AGs report. We talk about this scandal that is unfolding in New York. So where do we go from here? Like, what now? What are the steps that we can take as a legislature, as a state, to not only hold accountable the wrongs that have been done and provide justice for the families that deserve it and the answers they've been waiting for, but also to make sure that we can learn from this experience and move forward with integrity?
Yeah, and I think, Senator, you and I, we've published an op-ed right after the new legal immunity bill was passed, speaking to this point, which is we need to really invest in home care. And one of the main reasons that I voted against the budget was because we were making home care services much more difficult in last year's budget, as well as we're cutting 20% Medicaid, which is, if you think about it, it's mind-boggling how we did that. But investing in home care is the way to go, and um, finding some sort of justice. Repealing legal immunity is definitely one, but I'm also pushing for some sort of a fund to take care of the 15,000 people who lost their loved ones and their families, and people who survived COVID. There's a lot of older adults in these facilities that are still dealing with health problems and extra health costs. Like, we should be able to help them with that as well.
So, as you can tell, apparently, what is good for the goose is not good enough for the gander. Thank you very much for joining us on Lit Politics. The next segment, we will be talking about the hearings that you heard about, the questions that weren't answered, so many of them weren't answered, and the cover-up. Stay tuned for our next segment.
Lit Politics.